Look closely at these two skin lesions. To the naked eye, almost identical, but one is harmless. The other is a programmed killer, a melanoma in invasion mode, ready to enter your bloodstream. Now look at your own skin, all the moles you have. Are you sure there isn't an imposter hiding in plain sight? Almost 105,000 Americans will be diagnosed with melanoma this year. Over 8,000 won't survive. Melanoma is less common than other skin cancers, but it's the one that kills. Today, we're unmasking this enemy. We're going far beyond the basic ABCDE rule you've heard. I'll show you 5 signs and disguises that most people, and even many doctors, miss. We'll expose hidden risk factors, and I'll show you how new treatments are turning former death sentences into survival stories. And here's the twist. Sign number 1 on our list goes against almost everything you've heard about skin cancer. It's also what saved my patient Sarah's life. But first, hit that like button, subscribe to the channel so you don't miss our health tips, and click the bell for notifications. Share this video with your friends and family. By sharing, you're helping save lives. And tell me, have you or a family member ever had a scare because of a mole? What happened? Which part of the US or world are you from? Write it below. Let's go. Why is melanoma called the king of metastasis? The skin has several layers. Melanocytes, the cells that can become melanoma, live at the base of the top layer, the epidermis. When cancer forms, it first grows sideways along the skin. The real danger starts when it grows downward into the dermis. The dermis is full of blood vessels and lymphatic channels. Once melanoma reaches that superhighway, cells can travel anywhere in the body. That's how a spot just a few millimeters wide on the skin can end up as a tumor in the brain. The time to act is the window between this lateral growth and vertical invasion. And that window can be short, so you must know the 5 important signs of melanoma and stay alert. Sign 5. The ugly duckling. Your body has a pattern. Your moles, nevi, usually follow that pattern. It's like your skin's signature. The ugly duckling sign is when one mole breaks that signature. It's the mole that looks different from the rest. Biologically, this is a red flag. It may represent a new colony of cells that stopped following your body's rules and started multiplying uncontrollably. Your brain is actually very good at noticing this pattern break. My advice: once a month in good light, look over your entire skin. Use a mirror for your back. Don't just look for ugly moles, look for the different one, the solitary one, the rebel. That's your first suspect. But the ugly duckling, by definition, is visible. It calls attention. What if the killer is smarter? What if it hides where you'd never think to look, breaking the biggest myth about skin cancer? That brings us to sign 4, the hidden enemy where the sun doesn't hit. You might be thinking, doctor, I have brown or dark skin. I'm not white, so I'm safe, right? The answer: your risk is lower, but not zero. Dark skin is not a shield. To show this, I need to tell you a real story. Bob Marley died at 36. The cause? Melanoma. It started in 1977 as a dark spot under his big toenail. The first doctor said it was just a football injury, but the spot grew, darkened, and became painful. A second doctor finally biopsied it. Acral lentiginous melanoma, the type that appears on palms, soles, and under nails. It does not need sun exposure to form. The recommendation was clear: amputate the toe. Marley refused. He chose a smaller surgery that removed only the nail and nearby tissue. For a while, he seemed fine. Then, in 1980, he fainted in New York. Tests showed melanoma had spread to his brain, lungs, and stomach. On his last attempt to fly home to Jamaica, his body couldn't take it. The plane made an emergency landing in Miami, where he died at just 37 kilometers. Bob Marley's story is brutal. It proves nobody is immune, and it shows how dangerous acral melanoma is. So check the soles of your feet. The the palms of your hands. And if you see a new dark vertical streak under a nail, especially on one single nail that wasn't caused by trauma and doesn't grow out like a bruise, see a dermatologist immediately. This type is rare in fair-skinned people, but it's the most common melanoma in dark-skinned and Asian individuals, breaking the myth that dark skin means no skin cancer. If a cancer that hides is scary, imagine one that also deceives. Sign 3, the mole that speaks, itch, pain, or bleeding. A benign mole is a group of stable, sleeping cells. A melanoma is an active lesion in conflict with surrounding tissue. That activity can show up as symptoms. Itching may mean your immune system is trying and failing to attack cancer cells. Bleeding or crusting with light touch can occur because the tumor forms abnormal, fragile blood vessels to feed itself. Don't ignore these signs. If a mole you've had for a while suddenly starts itching, hurting, crusting, or bleeding without trauma, it's asking for attention. Ask yourself, why would one mole among dozens suddenly misbehave? It's a sign of instability, and in cancer, instability means danger. Sign number 2, the colorless ghost, a melanotic melanoma. We're used to thinking of melanoma as a dark, heavily pigmented spot. But pigment, melanin, is just a byproduct of these diseased cells. If the cancer is very aggressive and undifferentiated, it can lose the ability to produce pigment. That's a melanotic melanoma. It may look pink, red, or skin-colored. It can be mistaken for a scar, a bug bite that won't go away, a wart, or even a basal cell carcinoma, a much less aggressive cancer. This is the most deceptive type. The rule here, any new skin lesion of any color that persists for more than 4 to 6 weeks and does not heal deserves professional evaluation. Don't rely only on color. Trust persistence. Sign 1, evolution. The one word that changes everything. Let's temporarily forget asymmetry, border, color, diameter. They matter, but they are just snapshots. The master clue, the one that opens 99% of early diagnosis doors, is not a static feature. It's movement over time. One word, evolution, change. Why is this more important than any single characteristic? Think about the biology. Your normal moles are like peaceful villages on your skin. Melanocytes formed them, they grew to a certain size and then stopped. They're stable. They follow the rules. Cancer is the opposite of stability. It is cellular anarchy. A melanoma cell is a cell that lost its instruction manual. It forgot how to die. It forgot when to stop. It only knows how to make defective copies of itself, endlessly. That chaotic multiplication is what you see as change on the surface. A mole that grows, changes color, gets a new border, starts to itch. It's not the mole getting weird. It's a visible sign that a biological war is happening underneath. That's why evolution is the confession of the crime. A mole can be big or asymmetrical from birth and stay harmless. But any mole that changes is signaling rebellion. It's the only sign that's a verb, and it demands your action. It was this understanding that saved Sarah in my clinic. She came in very worried, pointing to a red, irritated, itchy lesion on her leg. "Doctor, I'm scared this might be cancer." I examined it, and even without a dermatologist present, I reassured her it's dermatitis, a benign inflammation. She was relieved. Then, while checking her blood pressure, I saw a small mole on her shoulder. Tiny, multiple colors, asymmetrical, irregular border. I asked, "And this one, Sarah?" She glanced at it casually. "Oh, that? It appeared a few months ago. It's small, doesn't hurt, doesn't itch. I'm not worried." The leg lesion was harmless, but the shoulder mole was new, had several warning signs, and did not fit her usual skin map. It had evolved. The word evolution screamed in my mind. I sent her to a dermatologist urgently. Biopsy result, melanoma. We caught it in time, thanks to awareness and attention to change. Know your skin map, photograph your moles, and more important than anything, watch for change. If we act during that window of time, modern medicine can do incredible things. Not long ago, a melanoma with brain metastasis was almost always a death sentence. Then, in 2015, something changed. Jimmy Carter, former U.S. president at age 91, learned his melanoma had spread to 4 spots in his brain. The outlook was bleak. His doctors tried a newer treatment, immunotherapy. Result? A modern medical miracle. After treatment, scans showed his brain metastases were gone. He didn't just survive, he lived almost another decade, passing away at 100. His story brought hope worldwide. It showed it was possible to beat advanced melanoma. Immunotherapy, especially checkpoint inhibitors like ipilimumab and nivolumab, works by stripping the cancer's invisibility cloak and letting your immune system attack it. This is no longer theory, it's real. Patients like Jeff Marles, diagnosed in 2017 with brain metastases, are alive and well years later. This isn't just statistics, it's real hope. And as a final tool, here's something you can use right now, the ABCDE guide. Save this video. A. Asymmetry, one half of the mole doesn't match the other. B. Border, edges are irregular, jagged, or poorly defined. C. Color, multiple colors, different shades of brown, black, red. D. Diameter, larger than 6 mm, about a pencil eraser. E. Evolution, the most important, the mole changed in size, color, shape, or started to itch or bleed. That's the ABCDE. When in doubt, see a doctor, ideally a dermatologist. Share this guide and help save a life. We've spent the last few minutes building your best external defense against melanoma, knowledge. But what about your internal defense? Watch the next video about the surprising truth of rosemary tea. Like the video? If it gave you useful knowledge, hit like and share it. This information needs to reach more people. My name is Andre Wambier, cardiologist, and this is Dr. DRE Health Tips. Remember to subscribe. Until the next video, thank you so much.